In this video, we will explain to you how we can introduce tobacco-related topics and fully integrate it into the medical curriculum across the 4.5 years of undergraduate medical education. Here is an overview of what you will see in this video. I will first briefly review the history of our project Quit Tobacco International and explain why we have focused on the training of medical students. India is facing a tobacco epidemic. 24% of men smoke around the country and 32.9% are using some form of chewing tobacco. 10 lakh people die each year due to tobacco use in India. In order to prevent these deaths, it is imperative that doctors receive training in the harms of tobacco and how to counsel every smoker to quit. There is a growing awareness of the harms of tobacco in India, and the government of India is responding with growing legislation. The people also know more about tobacco, and more people are coming forward to quit tobacco. But the doctors do not have the adequate knowledge or the skills to support them in the quitting process. This is the reason why we included tobacco topics and cessation into the medical curriculum. Indian medical schools are ready to receive tobacco curriculum. QTI surveys carried out in 5 public and private medical colleges in Kerala and Karnataka have established that there is widespread support for this among both faculty and students who recognize the need for both more information on the harms of tobacco and on cessation skills. Faculty has reported that they require more cessation skill training and resources to do this and promote a smoke-free campus. In response to this need, QTI developed, pre-tested and piloted a curriculum in 5 medical colleges. These are the 5 medical colleges who participated in the tobacco curriculum development and testing. Project QTI is funded by the Fogarty International Center of the National Institute of Health in United States. It is a partnership between the US, India and Indonesia. One of our main objectives has been the development and implementation of a tobacco curriculum for medical students and a training program which will provide them the skills in how to counsel patients to quit. The US Coordinating Center for this initiative is the University of Arizona, and the Coordinating Center in India is Sri Chitra Tirunal Institute for Medical Sciences and Technology, Thiruvananthapuram. We are an interdisciplinary team of doctors, social scientists, and an addiction specialist. In this video, we will introduce you to the curriculum and inform you how you may implement in your medical college. We will then tell you how to get access to all the materials you will need to do so, made freely available to you by QTI. Our program is unique in that it trains students how to tailor cessation messages to the specific health concerns of the patient and uses illness as a teachable moment. We employ the case of TDMC Medical College, Alappuzha, as a case study of a campus that successfully introduced the curriculum. Tirumala Devasam Medical College, TDMC, Alappuzha, is a rapidly growing medical college in the state as a center of excellence in every field of modern medicine. The prestigious institution, with a history of nearly 50 years, produces around 150 doctors per year and stands as a center of solace for common man. It was by the last month of 2008 that TDMC joined hands with Quit Tobacco International and started its journey to a dream, tobacco-free campus. Until then, tobacco and its ill effects on different organ systems were not well defined in the curriculum. The medical curriculum mapping was conducted to identify where in the 9 semesters of undergraduate medical education different tobacco-related subjects could be introduced. Community Medicine Department was rightly chosen by QTI as the coordinating department. From among the faculty in the Community Medicine Department, a faculty was chosen as the coordinator with a team, here being Dr. Sairo Philip.
We are proud that TD Medical College is the first government medical college to be partner in the Quit Tobacco initiative. Even though we have some obstacles which is unique to the government setup, I am determined to make this initiative a success because we want to experience the synergy of working with medical colleges both within the state and outside the state as well as out of the country in this crusade against tobacco. This networking will help us to learn the process and do many things. Secondly, it gives immense opportunities for capacity building. Each medical students meet at least one smoker a day, and there are at least 750 medical students in this college. Now, if they lose this opportunity, then it is a lost opportunity.
ഡോക്ടർമാരാണ് വലിക്കാൻ പാടില്ല എന്നൊക്കെ ആണെങ്കിലും ഒളിച്ചും പാത്തും ബാത്റൂമിലൊക്കെ ഇരുന്ന് വലിക്കുന്നവരൊക്കെ ഒരുപാടുണ്ട്.
നാളെ ഈ മെഡിക്കൽ വിദ്യാർത്ഥികൾ വലുതായി ഡോക്ടറായി കഴിഞ്ഞ് പുകവലിക്കുന്ന ആളെ കാണുമ്പോൾ അവരെ ഒന്ന് ഉപദേശിക്കണമെങ്കിൽ അവരുടെ അടുത്ത് പുകവലി നിർത്തണമെന്ന് ആധികാരികമായി പറയണമെങ്കിൽ ആദ്യം സ്വയം നന്നാകണ്ടേ.
ക്യാമ്പസിൽ ബോയ്സിന് പൊതുവെ ഒരു വിചാരമുണ്ട്, സ്മോക്ക് ചെയ്യുന്ന ബോയ്സിനെയാണ് ഗേൾസിന് താല്പര്യം, അത് അവരൊരു ഹീറോയിസമായിട്ടോ അല്ലെങ്കിൽ സ്റ്റൈൽ ഐക്കണായിട്ടോ ആണ് കാണുന്നത്. പക്ഷേ ബട്ട് വി ഫൈൻഡ് ഇറ്റ് സോ ഡിസ്ഗസ്റ്റിംഗ് ആൻഡ് ഷെയിംഫുൾ.
The baseline survey conducted revealed that medical faculty and students were interested in receiving more education on tobacco-related illness and cessation counseling as part of doctors' professional role and should be taught in medical colleges. Less than 20% of the faculty reported that they are competent to teach specific topics on tobacco. More than 85% participated in the survey supported smoke-free college campus policy. Based on survey results, 15 tobacco modules were developed at Achyuta Menon Center for Health Science Studies of Sri Chitra Tirunal Institute for Medical Sciences and Technology, Thiruvananthapuram. The main goal behind this was to develop a flexible ready-made module on tobacco topics to be adopted and fully integrated into the undergraduate medical curriculum across all years of the course. The main objectives of the curriculum are to educate medical students on the impact of tobacco on all organ systems and disease processes and to provide skills on brief tobacco cessation interventions. The modules were developed with the main information in PowerPoint presentation after extensive browsing of latest research findings from peer-reviewed and renowned journals with reading materials and case scenarios for application of knowledge. The module developed were piloted among the students and faculty to know how the contents were, whether any additions or deletions were needed, whether the faculty found it easy to prepare and implement, and whether the materials provided were useful. A mock-up class was conducted with nearly 10 students by a faculty member who collected the feedback forms from the students. The feedback received by the QTI was looked into and the necessary modifications were made slide by slide wherever needed. Once the modules had been developed and it was finalized with the feedback from the faculty as well as from the students, we held a pre-implementation meeting with all the HODs and faculties in each of the medical colleges. Here, we explained how one module is to be taken by demonstrating each part of the module. All the queries from the faculty as well as from the HODs on how a module should be implemented, what are the hurdles that they expect would be coming while implementing the module were discussed. A soft copy and a hard copy of the module was given to each of the faculty members. 15 modules were developed related to tobacco and different organ systems comprising of 6 components. These modules illustrates tobacco's relevance to most health problems. The parts of the module are the following. Mini lectures. Each module consists of 2 to 5 mini lectures, which are short presentations on the topic that can be used independently or joined together to form a larger lecture, each supported by PowerPoint presentations on evidence-based core slides, country-specific supporting slides, and optional slides which may or may not be used by the faculty forms the first component. These PowerPoint presentations have speaker notes to help lecturers if they need more information on the topic. Case scenario. A clinical case based on the organ system on which the module is based is presented with focus on the relevance of tobacco use and that disease. Fact sheets. A single sheet containing the salient points of the module is given to the students. Clinical videos. 14 clinical videos of doctor-patient interaction on tobacco-related disease pertaining to different organ systems is also present. Sample examination questions. A set of questions, short notes and multiple choice questions is provided to the faculty for inclusion in internal or external examinations. Reading materials. Articles and reports of index journals and organization is also included for reference and further reading. All parts of the module can be taken in a flexible manner according to the convenience of the faculty or the type of teaching followed in the medical college. Mini lectures can be taken in the classroom as lectures using PowerPoint presentation, OHP or Blackboard. Case scenarios can be discussed using role play of students using a professional patient in the audiovisual seminars or sessions or as bedside teaching. Fact sheets can be distributed to students either during lecture class or during the bedside teaching or case scenario discussion. Clinical videos can be shown at the end of a lecture class or in audio-visual sessions. Some modules have been taken by the faculty from other departments using community medicine teaching hours. Students are exposed to the modules from the 1st to the 8th semester according to the subjects they are learning at each semester. Cessation is the most important aspect that QTI gave emphasis to, since it is the only means of reducing death toll due to tobacco in shorter term. Cessation training workshop was conducted for the faculty, 5 each identified from the 5 medical colleges, at the end of which they practiced the skills on 15 persons, enter a brief intervention log based on which they are evaluated and then certified as brief intervention trainers. Under their guidance, students were trained during 4th semester on brief intervention. Students also fill up 5 BI logs in the 4th or 5th semester by practicing cessation skills on persons and then appear for the OSCE examinations carried out during the 6th or 7th semesters. QTI also offers students an opportunity to become BI trainers. Students interested can complete 15 BI logs and take a certification examination and receive certificate from the University of Arizona and Sri Chitra Tirunal Institute. From 3rd semester onwards, training on brief intervention starts for the students by the faculty already trained in cessation skills and certified. Cessation clinics were set up at the medical colleges where students were posted as a part of their academic training in tobacco cessation. Students practice tobacco cessation counseling on patients by tying smoking to the patient's immediate health problems and to their long-term health risks. They practice what they learned from the mini lectures, case scenarios, fact sheets, and the clinical videos. Students are also aided with clinical videos and cessation materials they get from the QTI website.
The modules provided were very useful for undergraduate teaching. Actually, the supporting notes were also very useful as it reduced the time required to prepare for the class. We could motivate the students to spread the message of adverse effect of tobacco smoking as well as the effect of second-hand smoking to patients, pregnant patients and the relatives as they interacted with these patients in the wards.
My personal experience, I found that this module is very, very useful for the students as well as the practicing physicians.
So we take them regularly classes in our wards, while there are long lectures also for bigger batches. So for both the batches we are taking these modules, and we have found it very useful, especially on the subjects like asthma, TB and malignancy.
Slides are very useful for teaching both students as well as patients because the slides are self-explanatory. Towards the footer, you can find the explanation regarding the respective slide.
Out of the 14 modules, we already taught the students with the 3 modules during your up to the 3rd semester.
This experience is useful for each medical professionals to address other behavioral problems like alcoholism. Same strategy may be used to create tobacco-free spaces in community, which will discourage the newer generation in taking up this habit.
The endline survey conducted to evaluate the whole process completes the activities. This survey proved again that the QTI activities were not imposed on the colleges. Rather, it was a participatory process which provides satisfaction to both ends. Most faculty and students found the contents in the mini lecture to be very relevant. The speaker notes and the references allow the faculty to lecture on topics with confidence. Students found the clinical videos to be very informative and practical in giving guidance on how to help patients quit tobacco with specific information and support.
എങ്ങനെ നമ്മുടെ ശരീരത്തിലെ ഓരോ ഭാഗങ്ങളെയും പുകവലി എങ്ങനെ എഫക്റ്റ് ചെയ്യുന്നു അതൊക്കെ ഒരു പിക്ചോറിയൽ റെപ്രസെൻറ്റേഷൻ തന്നെ കിട്ടി. നമുക്ക് പറഞ്ഞു കേൾക്കുന്നേക്കാളും കൂടുതൽ മനസ്സിലാവുന്നത് അത് കണ്ട് അറിയുമ്പോഴാണ്.
16 years old മുതൽ തന്നെ ഈ ടുബാക്കോ കൺസ്യൂം ചെയ്യുന്ന ഫാദറാണ് എൻ്റെത്. ഇപ്പോൾ 47 years. ഇത്രയും കാലമായിട്ട് ഞങ്ങൾ പറഞ്ഞുകൊണ്ടിരുന്നിട്ടും ബാപ്പ അത് നിർത്താൻ തയ്യാറായിട്ടുണ്ട്. അപ്പം അതിനെനിക്ക് സാധിക്കാത്ത പക്ഷം എനിക്ക് സമൂഹത്തിലിറങ്ങി ഇതുപോലെ അഡിക്ട്സ് ആയിട്ടുള്ളവരോട് അത് പറഞ്ഞ് അവരെ കൗൺസിൽ ചെയ്യാൻ പറ്റുമോ എന്നുള്ളൊരു ഇത് മനസ്സിലുണ്ട്. പക്ഷേ മാമിൻ്റെ ക്ലാസ് കഴിയുന്തോറും അവസാന നിമിഷം എത്തുമ്പോൾ എനിക്ക് ഉള്ളിലൊരു കോൺഫിഡൻസ് കിട്ടി, ഒരു മോട്ടിവേഷൻ ആയിരുന്നു. അപ്പോൾ ഞാൻ വീട്ടിൽ പോയി എൻ്റെ ബാപ്പയുടെ അടുത്ത് ഈ കാര്യങ്ങളൊക്കെ പറഞ്ഞു. ഈ സ്മോക്കിംഗ് ചെയ്താലുള്ള ഹെൽത്ത് പ്രോബ്ലംസ് അല്ലാതെ ഇമോഷണലായിട്ടുള്ള പ്രോബ്ലംസ് എല്ലാം പറഞ്ഞ് മനസ്സിലാക്കി. അപ്പോൾ ഒരു ചലഞ്ചായിട്ട് ഏറ്റെടുക്കുകയായിരുന്നു. 1.5 months കൊണ്ട് അത് കംപ്ലീറ്റ് ആയിട്ട് ലൈഫിൽ ക്വിറ്റ് ചെയ്യാൻ പറ്റി.
The methodology that was adopted was very much comfortable, that it could be easily adopted and it could be conveyed to the public very easily, and most of them accepted it well, that it helped very much in the controlling of the tobacco usage. And I hope this will be very useful in all controlling that in all the colleges all over India.
Each medical college has a field area where students go for community outreach programs. Here, teachers and students take classes on the ill effects of tobacco use with the help of models using analogies in a simple language.
ഈ കൊള്ളിൻ്റെ വ്യാസം പോയാൽ എന്നാ പറ്റും? ഹാർട്ടിന് ഹൃദയത്തിന് കൂടുതൽ ശക്തി എടുക്കണം അല്ലേ പമ്പ് ചെയ്യാൻ. അങ്ങനെ ശക്തി എടുക്കുമ്പോൾ എന്നാ പറ്റും? ഒരു ദിവസം അതും തളരും.
They also use spirometers to evaluate the lung capacities of the community in order to show them the effects of tobacco. A community outreach program gives students an opportunity to make use of the knowledge they have gained and practice it on the people according to the need. This will not only help them to practice their skills but also provides important information to the public on the ill effects of tobacco and second-hand smoking. These grassroots level endeavor also provides support to those who wish to quit tobacco. Along with academic activities, students also participate in other campaigning activities to eradicate tobacco from their campus. It was the discussions initiated by QTI that generated the positive spirit among students to fight tobacco. World No Tobacco Day is observed in all colleges, giving messages to the students through skits and marches organized by them. Within no time, posters urging to quit tobacco filled campus walls. There, the medical institution was setting a model to be essentially replicated.
During this 3-year Quit Tobacco program, 14 different clinical departments have introduced tobacco-specific modules in their disciplines. We are putting all our efforts to make our campus, including our hospital, tobacco-free.
Tobacco use is increasing in India and not only killing 1 million people a year, but also resulting in increased morbidity, which is a huge financial burden on both households and the healthcare system. QTI proves that from quit lines to counseling to prescription medicines, there are numerous effective ways to quit tobacco, even though it is not easy because of tobacco dependence. It is the need of the hour. Present and future generations must be urgently protected from the devastating health, social, environmental, and economic consequences of tobacco consumption and exposure to tobacco smoke. To adopt this tobacco curriculum in your college, please visit our website quittobaccointernational.org, which provides modules and cessation materials freely. Inclusion of tobacco topics in the medical curriculum is necessary, as is training in brief intervention for tobacco cessation. The medical curriculum and tobacco cessation training developed can be implemented in other medical colleges around India. Doctors need intensive training so they can begin to see cessation as a normative part of their practice. QTI is trying to create a network of medical colleges committed to making tobacco cessation a normative part of their medical practice.
I believe that this experience helped us to build a team, and a team means together each achieves more. In this process, the community, the college, the students, the faculty, the patients and their families are achieving more when we work together. Thank you.